Lithium is one of the oldest medications we use in psychiatry, and is still one of the most evidence supported. It is interesting because lithium has been around for decades, but when you look at modern guidelines, it hasn't been replaced. The CANMAT and ISBD bipolar guidelines and even more recent updates in practice recommendations still list lithium as a first-line treatment option for acute mania and for maintenance treatment. And the reason is simple. It works across phases of the illness. Lithium has strong efficacy in treating acute mania and is one of the most reliable agents we have for preventing relapse, especially manic relapse. But what really sets lithium apart is something we don't consistently see with other mood stabilizers, and that is its association with suicide risk reduction. A large meta-analysis by Dr. Andre Cipriani and his colleagues, published in the BMJ, found that lithium significantly reduced suicide and self-harm compared to placebo in patients with mood disorders. And that finding has been replicated and supported in subsequent long-term observational studies. So this is not just symptom control. We are talking about an outcome that directly impacts mortality. There's also ongoing discussion in the literature about lithium's potential neurobiological effects, including effects on neuronal signaling and cellular resilience. But the evidence is still evolving but should be interpreted carefully. Now, the hesitation around lithium is usually not about its efficacy, but it's about safety and monitoring. And yes, lithium requires monitoring renal function, thyroid function, and serum levels. But what's important and is emphasized in both clinical guidelines and pharmacology literature is that many of the long-term risks are dose and level dependent and often influenced by comorbid conditions like hypertension or diabetes, not lithium alone. So the real issue is not whether lithium is effective. It clearly is. The issue is whether we are using it correctly and consistently. But when we do, lithium remains one of the most reliable treatments we have in bipolar disorder. I hope you've learned something today. Take care.